Hello everyone, this is Vinita. Welcome back to Vinita Online Nursing Classes. Today we are going to discuss the topic that is oxygen administration from the subject that is foundations of nursing. So this topic will be benefit for all the students, and also this will be useful for in the theory part and also in the practical part. Okay, let me introduce the topic of oxygen administration. See here the introduction of oxygen. Oxygen, we know that generally it is a gas which is found in air and it has no color, smell or any taste. See here the human being is living by oxygen only. Okay, so that the oxygen is very necessary for human life. And also the symbol for the oxygen is O and the atomic number of oxygen is 8. Coming to the next point, that is oxygen makes up 21% of the atmosphere by volume. Okay, so how much percentage it is making up the atmosphere by its volume? So it is making up the 21% of the atmosphere by its volume. Okay, and it is the oxygen is mainly obtained by two methods, that is distillation of liquid air, and second method is by passing a clean dry air through zeolite. Means, so by the zeolite that will be observing the nitrogen and it will be leaves the oxygen. Okay, so this oxygen is mainly obtained by the two methods. One is the distillation of liquid and second one is passing a clean dry air. Okay, so how the distillation of liquid air and passing a clean dry air? So only through the zeolite, so that the zeolite will be absorb the nitrogen and leaves the oxygen. Then this oxygen is used in industries, and also these oxygen will be used in the industries, especially like a water treatment, like as a water therapy. Okay, then coming to the definition of oxygen administration. We know that already in the introduction part we have discussed regarding the oxygen. It is a colorless, odorless and the tasteless. Okay, so here the oxygen therapy means oxygen administration definition. How we are going to administer the oxygen for the patient? Let us see. So here the definition of the oxygen administration is a process. It is a such kind of a process by which supplemented oxygen. Okay, see here the oxygen administration is such kind of a supplemented oxygen. Okay, so the supplemented oxygen is administered in high concentration. Okay, so how the oxygen supplemented oxygen is administering to the patient? So in an high concentration than that of atmospheric air. Means we know that oxygen we used to get by the atmosphere. Okay, but here the oxygen administration is one of the process, means like supplemented oxygen will be provided to the person. So whatever the supplemented oxygen we are going to administer for the patient, that should be in a higher concentration than, so the higher concentration and also the supplemented oxygen, that should be when it is going to be compared with the atmospheric air, so that should be highly concentrated when they are going to compare with the atmospheric air. Got it? So this is the definition of oxygen administration. Means like the administering of oxygen by inhalation from a cylinder. So generally next slides you can able to see what is the process of administering the oxygen. Okay, like there will be the connection of the cylinders, pipes. Okay, like system liquid oxygen concentration will be having like various methods. So by that they are going to provide administering the oxygen to the person. Okay, so here the administering of the oxygen will be relieving the person from the anoxemia. Okay, so means there is a normal good breathing pattern will be provided. So they are by supplemented oxygen we are going to provide the providing the relief from the anoxemia means hypoxia. Okay, general we are going to provide the normal pattern of the breathing level for the person. Okay, so this is the definition of oxygen administration. Okay, coming to the purposes of oxygen administration, especially what is the main purpose to administer the oxygen means, especially there are the two main purposes for the administration of the oxygen. The first one is to facilitate normal metabolism of the tissues. Okay, so how they are going to facilitate the normal metabolism of the tissues? By providing the supplemented oxygen. Okay, then second purpose is to reduce or correct arterial hypoxemia and tissue hypoxemia. Okay, so means reducing, to relieve or to correct the hypoxemia means atrial hypoxemia, and also the tissue hypoxemia will be present in the patient. So to reduce, and also not only reducing and to correct those two hypoxemias means atrial hypoxemia and the tissue hypoxemia will be corrected by the oxygen administration. So these are the two main purposes for the administering of the oxygen for the client. Okay, coming to the indications for the oxygen administrations, especially we used to see that there are the many indications for each and every procedure. So here also to administer the oxygen, supplemented oxygen for the client, so there must be such kind of the indications. The indications for the oxygen therapy, or the first one is the breathlessness or labored breathing. So if the person is having with the breathlessness or the labored breathing means very hard to breathe, the normal, very hard to inhale the normal breathing. So this is one of the indication, first indication for administering the oxygen. Coming to the second one, that is the high altitudes. Okay, the person who are living in the high altitudes. Okay, then third one is the patients who are having or under with the anesthesia. Okay, patients who are under with the anesthesia. And the fourth one is patients who are critically ill. Means critically ill means the patient is unable to inhale and exhale, means the condition of the client is critically ill. So for that is also one of the indication to provide to administer the oxygen. Then next one, shock. The person or the patient may undergoing for the shock. This is also one of the indication. Then next one is the sixth one, that is patients with a decreased respiratory capacity, means there is no normal respiratory status in the client. So for that patient, so that is the indications for the administering of the oxygen. Okay, these are the indications for the administering of the oxygen. And also the next one is the circulatory failure. So if the person is having any failure in the circulatory system, so then there is a chance for the administering of the oxygen. Then next, okay, these are the indications of the oxygen administration. Then coming to the contraindications of oxygen administration. So here to administer the oxygen, generally the contraindications, especially like whatever we are going to administer the oxygen, so that should be administered with the caution. So exact idea, caution should be there, caution to the patient with the COPD, especially we should maintain particular type of the caution while administering oxygen to the patient who are having with the COPD, means chronic obstructive pulmonary disease, means so that will be inducing the hypoventilation. Okay, then coming to the second contraindication is the atelectasis. So like lung disease and also the oxygen toxicity. These are the three types of the three contraindications for the administering of the oxygen. Got it? So these are the contraindications. Coming to the methods of oxygen delivery. Okay, see here. The methods of oxygen delivery will be very in detail topic. For each method it takes a long time, but in this class I am going to deal it in a short way. Then next class I am going to deal each method for each class. Okay, so here the methods of the oxygen delivery, especially there are the 4 methods. 5 methods. The first one is the nasal catheter method, and the second one is the nasal catheter method, and second one is the nasal cannula method, and third one is the transtracheal oxygen method, and fourth one is oxygen masks, and fifth one is oxygen tent. These are the methods of oxygen delivery, means these are the 5 methods of administering of the oxygen to the client. Let's see one by one. So what is the first one? Nasal catheter. So this is the picture shows the nasal catheter, means so here these nasal catheters are used less frequently these nowadays, because it involves like inserting an oxygen catheter, means like a simple rubber catheter. So here there is a simple rubber catheter into the nose. So how they are going to insert these nasal catheter, means nasal means nose. Okay, so here these rubber catheter they are inserting into the nose up to the nasopharynx. Okay, it needs like this nasal catheter needs to be changed at least every 8 hours. Okay, so whatever we have inserted into the nose up to the nasopharynx, so these catheter that should be changed every 8 hours and inserted into the other nostrils. So here changing means we should not change the catheter, but we should change the nostrils. So if we have inserted into one nostril, then after 8 hours we should be changed into the other nostril, because so here there should not be raising of any inflammation or the infection in the nasopharynx. By that, so we can able to maintain the good maintenance, a good condition of the patient. So here this nasal catheter is very painful. Sometimes it also can cause trauma. So like it is very less desirable. Okay, this is the first method of oxygen delivery. Okay, coming to the second one is nasal cannula. So here nasal cannula, this is the picture shows the nasal cannula. So here it is a very comfortable and simple device for the patient. So when we are going to use this method, the patient feels very comfortable. So here the 2 cannula, so there are the 2 cannulas will be present. The 2 cannula size will be at least 1.5 centimeters, means half inch. So the cannulas will be at least half inch long. So these whatever the nasal cannulas, so that will be like protrude from the center of a disposable tube, and that will be inserted into the nares. So here from the center of the tube, center of the disposable tube, that will be protruding from the center of the disposable tube. Then after it protrudes, then we are going to insert into the nares, means we are going to insert into the nostrils of the client. So this is the second method of oxygen administration. Coming to the third one, that is transtracheal oxygen. So here see here transtracheal oxygen, the word itself says the meaning. Tracheal means where they are going to administer the oxygen supply to the patient, so by the trachea. So here see the picture shows that transtracheal oxygen connect. So here the trachea track. Okay, so they are going to connect here. Okay, see here these transtracheal oxygen in this type, in this method of oxygen administration, the oxygen will be delivered directly into the trachea. See here, so this is the trachea. So here where the oxygen is going to deliver, the oxygen is going to deliver directly into the trachea. So how the oxygen is going to directly, how the oxygen is delivering directly into the trachea? So only by the catheter. So here they are going to by the way of catheter, through the catheter the oxygen is going to deliver into the trachea. Means, so there is a small intravenous size catheter will be present. So into the trachea through a surgical opening in the lower neck. So here we are opening. So surgical opening in the lower neck means there is a small surgical incision they are going to perform for the client. Then we are going to insert the transtracheal oxygen method. So this is the third oxygen administering method. Then coming to the fourth one is the oxygen mask. We know that generally many people were habituated for this mask because if you are having any lung disease, like any abnormalities, respiratory problems like bronchial asthma, so any type of these type of the conditions, so if you are going to take the nebulization procedure also, there is a connection of the mask. So here we know that oxygen mask, we used to call it as a BLB mask. BLB mask. BLB means Booth by Loveless Bulbulian. BOOTHBY. Booth by Loveless. LOVELAC. Loveless and Bulbulian. BULBULIAN. So here this oxygen mask is we know that it is a device. Mainly this oxygen mask is used to administer humidified oxygen. Okay, so here humidified oxygen, we know that if you are going to administer the nebulization, we are going to administer the humidified oxygen for the client. So here this oxygen mask, it is strapped to fit snugly to the mouth. We know that how we are going to fit, we are going to fit it to the mouth and the nose, so that will be secured in the place with the strap. So here, so after fitting to the mouth and the nose, so we are keeping secured place with the strap. So this is the strap. Got it? So this is the fourth method of oxygen administration. Then last method of oxygen administration is the oxygen tent. So the another name for the oxygen tent is CMR tent. SEYMOUR. See here, the picture shows same that like the tent. So here they are going to administer, means overall they are going to cover like a tent. See here, when a patient has any facial injuries or like for any other reasons, they cannot tolerate oxygen mask, then this method can be used. Got it, ma? So see here, if the patient is having any facial injuries, so they are not at all tolerating the nasal catheter, they are not at all tolerating the nasal cannula, oxygen mask, transtracheal oxygen, then this type of the oxygen tent is going to be used for the client. Okay, so here this tent is first flooded with the oxygen, then it is having the flow of 4 to 5 liters per minute. So how many liters? 4 to 5 liters per minute that should be given, and this will be maintained like service like 40% to 50% in the tent. So here there is a 40 to 50% of the oxygen will be present inside of the tent, and there will be present of the like oxygen flooded with the oxygen will be present at least 4 to 5 liters of the oxygen will be present over inside of this tent. Means this type of the CMR tent. Got it? So these are the 5 methods of oxygen administrating methods. Got it? Then coming to the scientific principles of administering oxygen. Okay, see here, let's see, there are the many of the scientific principles for the administering of the oxygen. So the first one is, since oxygen acts as a drug, so we know that if it is acting as a drug, it must be prescribed, administered in specific dose. Yes, and then when we are using like a oxygen cylinder, a regulator and the humidifier, when using a oxygen cylinder, use a regulator and the humidifier. So we should use if we are using the oxygen cylinder for the administering of the oxygen, so we must remember that we have to use the regulator and the humidifier, because so the purpose of the regulator is especially for reducing the pressure of the oxygen in the cylinder, like that will be providing to a safer level. Okay, so by that maintaining the particular regulator and the humidifier, the flow can be measured in the liters. According to the liters, the flow can be measured like per minute. The liters, according to the flow, the liters will be measured per minute. And also they are going to adjust. We should be adjust like a flow of oxygen at least 2 to 4 liters. 2 to 4 liters per minute, especially the 2 to 4 liters should be adjust for the adults. When the nasal catheter is used, then we have to adjust the like flow of oxygen at least 2 to 4 liters. Okay, so this is the second principle, scientific principle for the administering of the oxygen. Then coming to the third one, the humidifier helps to saturate the oxygen. We know that. So here how the humidifier will be helping to saturate the oxygen means with water vapor, especially why the saturate the oxygen will be, why the humidifier is going to saturate the oxygen means like to prevent the drying of the mucous membrane of respiratory tract. So to prevent that kind of the mucous membrane of the respiratory tract, so the humidifier will be helpful to saturate the oxygen. Okay, then next scientific principle is humidifier works on the simple principle. So which principle? That when gas is passed, so here this is the principle, when gas is passed through water, the gas picks up the water vapor. So here by this principle, when the gas is passed, so here when we are administering the oxygen, we know that gas is passed to the water. So whatever the gas passing through the water, so that gas picks up the water vapor. So by this principle, the humidifier will be working over by these, based upon this kind of the principle. Okay, coming to the next principle is watch. So here watch the patient. We should be watch the patient who are receiving the oxygen therapy, so continuously, because to detect any early signs of oxygen toxicity. And when oxygen is see here and also we should change nasal catheter at least 8 to 8 hours or more often, because the mucus may plug mucus may plug the openings of the catheter, and sometimes it also will be making like blocks the oxygen supply. For that we should change the catheter at least 8 hours. Okay, so here since the oxygen supports combustion, okay, see here combustion, since oxygen supports combustion, 5 precautions that should be taken. Like when the oxygen is on flow, we should be caution regarding the 5 precaution. And also like when oxygen is administered through the nasal catheter, the whatever we are inserting the catheter, that should not be directed beyond the uvula. So here that should not be directed beyond the uvula, especially to prevent the gaseous distension of the abdomen. Okay, so here these are the principles, scientific principles of administering the oxygen. Okay, then let's see how we have to prepare the patient for the administering of the oxygen. Preparation of the patient for the administering of the oxygen. Okay, see here we should check the name, bed number and other identification marks of the patient. Because by the other identification marks means, so if the name will be same, if the bed number sometimes, so here we there is no confusion, because already bed number will be different. But sometimes there is a by mistake there is any changes in the bed number, so we can able to identify by the marks of the patient. Then we should check the diagnosis and the need for oxygen therapy, then we can able to administer the oxygen. Then also we should check the doctor's order. So here doctor's order, why we should check the doctor's orders means especially for the initiation of the therapy. So initiation of the therapy and initiation of the dosage. Okay, then and also we should assess the patients for any signs of clinical anoxia, and then we should assess the patient's vital signs. Okay, so here the vital signs like breathing patterns carefully, like we should watch carefully regarding the breathing pattern before starting therapy. Before starting the therapy only, we should watch over the patient's vital signs, especially the respiratory status of the patient. Then next we should explain the need of oxygen therapy, because by that the patient can able to cooperate with us, and also they can able to know the sequence of the procedure. And then we should keep the patient in a proper position. So here the proper position means there are the either we should be place the patient in a propped up position or the Fowler's position. So mostly we used to place the patient in the Fowler's position only. So here see in the next slide you are going to see the propped up position and also the Fowler's position. Okay, these are the points that should be remembered for the preparation, how we have to prepare the patient for the administering of the oxygen. Okay, we have seen that two positions. We should be place the patient in the two positions, either in the Fowler's positions or the propped up position. Already I told that. So most of the patients that they are going to place only in the Fowler's position. So here see this slide, this shows that the Fowler's position of the patient. So we should be the bed elevation, head elevation should be at least 30 degrees to 30 to 45 degrees. The head elevation should be there. Okay, so this is the position. And the second position, this is the propped up position. So here the propped up position of the head. See here propped up position means, like propped up means to stop something from falling or slipping, means with pillows or towels we are going to place the patient. So these are the two positions especially for the administering of the oxygen, but no one will be using this position, but all people, all the members, all the hospitals, major hospitals or very well known, they are going to use this kind of the position for the administering of the oxygen. Okay, we have seen the two positions, how we have to place the position of the patient in a proper position while administering of the oxygen. We have seen the two positions. Okay, so these are the preparation of the patient. Let's see what are the articles, preparation of the articles for administering of the oxygen. So there are the main article. The first one is the oxygen cylinder with the stand. So here see this picture, this is the oxygen cylinder with the stand. Okay, so here there is a presence of the flow meter for this oxygen cylinder also. Okay, then coming to the second article is the central supply oxygen with a flow meter. So the oxygen should be supplied in a central manner, central supply oxygen that should be supplied. So with the flow meter only we can able to observe. So by the flow meter only we can able to know the exact saturation, oxygen saturation levels for the patient. Okay, then third one is the humidifier or Wallace bottle. So the humidifier and the Wallace bottle, so they will be having the connecting tube for this humidifier and the Wallace bottle. Okay, so these are the majorly three articles for the preparing of the oxygen administration. Okay, so here more than this, a tray containing a tray. So we know the procedure tray. So here in that the tray contains, first one is the nasal catheter or cannula or oxygen mask. Already we have discussed in the method of oxygen methods. So either we can able to, so not only either, we have to place the nasal catheter, nasal cannula and nasal mask. So according to the patient situation we can able to take the choice according to the condition of the patient. Okay, then second article is water soluble lubricating gel. Why water soluble lubricating jelly means, so here if we are going to insert the nasal catheter or the nasal cannula, so for the easy insertion of the nasal catheter there should be we have to apply for the catheter, jelly should be applied for the catheter. Okay, then next one is the adhesive tape. Okay, then bowl of water. So there should be bowl of water and swab sticks. So these are the swab sticks. Okay, we should not, so the swab stick should be sterile swab sticks only. Okay, so see here especially The nasal catheter, cannula and the oxygen mask, especially here, why we are using these type means like to deliver oxygen by the nasal catheter, by nasal cannula or the oxygen mask, we can able to easily deliver the oxygen, and also we can able to check the amount of oxygen going to the patient. We can able to also check the humidifying the oxygen to prevent any infection. Okay, then water soluble lubricating jelly, we can able to easily lubricate the nasal catheter. Okay, then adhesive tape will be used for the attaching of the nasal catheter. So if there is any attachment for the catheters, so by the tape, this tape will be useful for the attaching of the nasal catheters. And then a bowl of water. So here the bowl of water, especially we know to check the oxygen flow. So in the flow meter we can able to observe the by the water only we can able to see the oxygen flow. Okay, then the next article in the tray is the swab sticks. So here the swab sticks will be with the sterile swab sticks, so especially to clean the nostrils. So if there is a changing of the cannulas or the changing of the catheters, so if there is having any problem or the any infection, so by the swab sticks we can able to clean the nostrils. So along with the swab sticks we should be there should be presence of normal saline. So here to clean for cleaning of the nostrils. Okay, so these are the articles that should be needed for the administering of the oxygen. Okay, coming to the procedure, let's see the procedure of the oxygen administration, how we have to administer, what are the procedure steps. Let's see. So see here, first, the procedure steps of the oxygen administration: wash hands. We know that for each and every procedure, for each and every, even though we are administering the any IV site or anything injection, so we are going to wash hands. So here this is the major ethic and the principle and the major etiquette that should be followed. So here the why we need to wash hands, especially for the reducing the transmission of microorganisms. So we have to wash hands with the soap and water. So by that only we can able to reduce the surface tension, and by that removing the dirt and prevents the growth of microorganisms. Okay, then after washing hands, second step of the procedure is we have to attach cannula or catheter mask to the oxygen tubing and humidified oxygen source adjusted to the prescribed flow rate. So here this will be preventing the drying of nasal and oral mucous membranes and airway secretions. By that use of a humidifier also will be prevents the drying of mucous membranes. Okay, then after attaching the cannula to the oxygen tubing, then we should be placed tips of cannula. We should be place the tips of the cannula into the patient's nares. So after attaching all the catheter to the oxygen tubing, humidified oxygen, then adjusting the flow rate, then immediately we can able to ready to attach the cannula to the patient nares, means nostrils. So if the mask if there is a presence of mask, then we should be apply snugly to the face. So if there is a mask is there, then we should be apply tightly to the face, means. So here these placing of cannula into the patient nares, that will be directly flows of oxygen into the upper respiratory tract. By that they can able to prevent the loss of oxygen. Okay, then fourth one is we should check after connecting the cannula. We always should check the cannula, means equipment, every 8 hours, because that will be ensuring the patency of cannula and oxygen flow. Okay, so and also these by checking of every 8 hours, that also ensures safe delivery of whatever we are going to prescribe the oxygen saturation levels. Okay, then after checking of the equipment, we should keep the humidification jar filled at all the times. Okay, humidification jar filled at all the times, so that will be preventing the inhalation of dehumidified oxygen. So there is no chance for the dehumidification, so that will be preventing the drying of mucous membranes. Okay, then we should observe the patient nares and superior surface of both ears and skin breakdowns. So if anything is happen, So why we should observe means sometimes the oxygen therapy can dry nasal mucosa, like pressure on ears from cannula, tubing, elastic, so that will also sometimes, so due to that elastic, so that also causes the skin irritation, so that we should observe the patient nails and also the surface of both ears and also the skin breakdown. Okay, then we should check the oxygen flow rate, check the oxygen flow rate and the physician's order every 8 hours. So here this checking of the oxygen flow rate and the physician's orders every 8 hours, so that will be ensuring the delivery of the prescribed oxygen flow rate. Then after that we came to know that there is a proper administering of the oxygen to the client. Then after finishing of our procedure, we should wash hands before removing the oxygen mask or tube, because to reduce the transmission of microorganisms. And then inspect the patients for relief of symptoms. So there is a presence of the symptoms which are associated with the hypoxia. So here these the symptoms which are associated with the hypoxia, that will be indicates that hypoxia will be already reduced by the administering of the proper administration to the client. Okay, then whatever we have finished, whatever we have administered the oxygen levels to the patient, that should be, we have to record the procedure in the nurse's note, because the documents will be having the correct evidence, correct use of oxygen therapy, and the patient's response will be appearing in the records. Okay, got it? So these are the 10 steps, procedure steps for the administering of the oxygen. Okay, oxygen administration. Got it? Then let's see what is the care for the patient after the administering of the oxygen, and what all are the care that should be like after using of the articles, what we have to do. Let's see after care of the patient and the articles. So here after the providing the administering the oxygen supply, we should always stay with the patient till she or he is at ease, means when the patient is like stable, till he or she get the like stable condition, we should stay with the patient and keep the patient warm and comfortable. Evaluate the patient's progress by observing the vital signs and the symptoms. So after administering, we should evaluate the patient's progress, like vital signs especially we should observe the respiratory status of the patient, and also we should observe the symptoms which are related to the upper respiratory tract. Okay, then we should watch the patient for any deteriorating symptoms. So after sometimes, if the patient is not at all if a patient is having in the critically ill stage, sometimes he or she may undergoing for the deteriorating stage. So for that we should observe the patient for any deteriorating symptoms, and also we should record procedure, when a date and the time, when we have, on which date, at which time we have done, that should be recorded in the particular notes. And request for an ABG analysis. ABG analysis means atrial blood gas analysis. So here atrial blood gas analysis, that should be specified intervals for the making sure for the hypoxia is treated or not. So these by analysis we can able to know. Okay, then take all articles to the utility room. Then we should clean nasal catheter with the cold water, then warm soapy water, and finally with the clean water we should clean, because there should not be any infection, means all the we should reduce the transmission of microorganism, means killing of the microorganisms. Then because by this cleaning of articles, utilizing of the articles in a proper way, by cleaning with the soapy warm water, hot water, clean water, so then we can able to easily after drying of the articles, we can able to there is a chance to provide for another client also. Then sometimes after cleaning, then we should be sterilized, we should be send the articles for the sterilization. So here the for each and every articles there should be sterilized in the sterilization room. Okay, got it. So these are the care of the patient after the procedure. Okay, so this is the procedure we have discussed regarding the oxygen administration in today class. Okay, oxygen administration we have been discussed. Okay, what we have seen the introduction part of the oxygen. It is a colorless, odorless and the tasteless gas. Okay, we have also seen the definition of the oxygen administration, purposes of the oxygen administration, indication, and also we have seen the contraindications and methods of oxygen delivery. There are the 5 methods: nasal catheter, nasal cannula, transtracheal oxygen method, oxygen mask, oxygen tent method. Okay, and also we have seen the scientific principles. What are the principles that should be used while administering the oxygen to the client, and preparation of the patient. And also we have seen what are the articles will be present over the tray. Okay, we have also seen the procedure steps. So first we should wash hands, then we should attach the cannula or catheter mask to the oxygen tubing and humidified oxygen source, so that will be adjusted to the prescribed flow rate. Then after adjusting to the prescribed flow rate, then we should place the tips of the cannula into the patient's knees. So if the mask is there, then we should be applied snugly to the face. Then check cannula or the equipment every 8 hours. We have to keep the humidification jar that will be filled at all the times. Then also we should observe the patient nares, superior surface of both ears and the skin breakdowns, because sometimes due to that pressure, the pressure over the ears or the elastic, that will be causing such kind of the skin irritation. Okay, and we should check the oxygen flow rate. After that we should wash our hands and remove the mask. Inspect the patient for any like relieving of symptoms, recording. We should, whatever we have done, that should be recorded in the nurse's notes. So we know that what is the care that should be provided for the patient after administering of the oxygen. Okay, stay home, stay safe, stay healthy. Thank you one and all.